What's unique about Flinders Private Hospital and its people? Well, it's a big heart hospital. It does all forms of cardiology and cardiac surgery. It's co-located with a big public general hospital, which also does all forms of cardiology and cardiac surgery. And the Flinders campus as a whole has always been regarded as a place where all forms of medical staff and nursing staff cooperate and get along well. It's not a place of silos where people only look after their own area. So it gives a holistic care of patients all the way from the very simple cardiology to the most complex of patients. Flinders Private Hospital has all the cardiac facilities that are needed to perform high-level cardiology and cardiac surgery. You're seeing around me a cath lab. Flinders Private Hospital has 3 cath labs, has access to CT of the coronary arteries and the heart itself, cardiac MRI, echocardiography for ultrasounds of the heart, stress testing, clinics, and of course an ICU department that has great expertise in looking after critically unwell patients with cardiac problems. Flinders Private Hospital is fortunate in that we have access to cardiac specialists, cardiac surgical specialists, and equipment and technology that is right at the cutting edge of cardiology care. This covers all the main areas of cardiology, such as coronary artery disease with stenting, electrophysiology with electrical procedures on the heart and ablations, devices like pacemakers and stent implantation, cardiac surgery. Flinders Private Hospital also has 4 cardiothoracic surgeons who perform all levels of cardiac surgery here on site, and an intensive care unit that can back up that level of cardiac surgery. Indeed, we have cardiologists, cardiac surgeons and intensive care doctors here who are on guideline committees for recommendations on how to treat all sorts of cardiac conditions that go out nationally. A patient should consider or choose Flinders Private Hospital when they're discussing with their referring doctor and their specialist of where to have their cardiac work done, because of the expertise of the specialists who work on this site, because of the technology and the cutting-edge innovations that are used at Flinders Private Hospital. Thirdly, and very importantly, which is often overlooked by many, it's the team environment looking after you in the hospital in your cardiac admission. And this includes the medical staff with cardiac surgery, cardiology, intensive care. This includes the nursing staff at all levels and the paramedical staff who all will work together to get the best outcome possible for your cardiac admission. Thank you for listening. I hope that you've found this information useful and it's answered some of your questions. Remember, if you have sudden onset or severe cardiac symptoms, to call an ambulance and get attention quickly. And indeed, Flinders Private Hospital does have a cardiac emergency centre which is open 24 hours, 7 days a week for just such issues. But prevention's better than cure, so look after yourselves.